All right, welcome back. This is Health Matters with me, Dishen Kumar, and we are here in Hotel Istana for the Alzheimer Disease International's 21st conference, Asia Pacific Regional Conference here. And today's conference is a 3-day conference. There's been a lot of topics we've been talking about. One of the main things, we also have guests from other countries. And today with me we have Sean Magnon, who is from Malta. Yes. Very small country, Sean, but you guys have done a lot. One of the countries to have a dementia plan. And let's talk about what you guys actually do for your aging population. What is the number of your population right now? And how many of them are in the older generation?
Okay, at the moment we have around about 500,000 Maltese nationals, of which 105,000 are older persons, over the age of 60, and another roughly circa 36,000 persons with disability.
Okay, and very interestingly, the types of services you guys provide for your older generation. What are the type of services?
We have an array of services.
Okay.
We have 2-1, which are the regular services, the classical services, and every year throughout these last years we have issued new services, new pilot projects, so that our elders can stay in the community and with their experiences, their expertise, their presence, they color the community, they give knowledge, they give through color, through experiences. One of our most successful pilot project, which is going nationwide in the coming year, is the Silver Tea, or better known as tuk-tuk.
Okay.
Basically, the services from a study and awareness that our older persons are staying at home and are unable to go to the local market, to church or to the local club, and to buy their purchases, or just to socialize with people.
Yeah.
So we identified that problem, and we're trying to mitigate by offering a specialized, tailor-made solution. Basically, the older person just calls a number. He chooses from a suite of times. Then the tuk-tuk is booked for 90 or 30 minutes exclusively, so it comes at your home. Takes you where
30 minutes is a long time.
30 minutes is, and when you see, from our understanding, people were booking taxis or booking other forms of transport, which are costly. So this empowers them to go out, recreate, buy, purchase, and socialize, and at the same time they're saving money. So it's one of the, it's really important.
So this 30 minutes, is it daily 30 minutes or?
They have a number of tokens. During this pilot project, they had a number of tokens, and they utilized in the manner they wanted. For example, they had 3 tokens in a week.
Okay.
So thereafter, during this pilot project, they will not be charged, but they would be put aside for another week. So, but once after the initial pilot project took off, the individuals, the frequency of the tuk-tuk increased, so the limit was removed.
But this is also great because you also create job opportunities for
creates,
people to
yes,
use
it creates job opportunities. It creates the macroeconomy in the locality increases. Even it is good to see, because in cities, when you go to big cities, you don't see older persons in the city. You see maybe people who are of workable age and who are students or officers. And when you see an elder person in the community, say, wow, this is the place where I can stop the older person, get information, get experiences from the past, and that's so enriching.
No, because it's important, because very interesting point you made there. When you go to bigger cities, you don't really see older people around walking about and doing things like that, because it's very difficult for older people to actually travel. Yes. To use public transport, they don't really have a lot of facilities for them, and it's great that Malta is actually doing this. What about other projects, other pilot projects?
the junior minister last week launched 2 new pilot projects. Basically, we have selected 2 localities in Malta where a doctor comes and takes a blood sample so that it can be checked. It is free of charge. The service, it is a personalized service. The doctor comes and the results are taken back to you, and he explains them in the simplest manner so that you are at peace with yourself. You don't have to go to your private physician or doctor, be charged and get just a technical jargon of that, but in the most easy way. And it's a hit. It's starting to be a hit, yes.
So it's like a free blood test. The doctor will come to the patient's house and actually do
just
a blood
call on a specific number, you book the appointment, and the doctor comes at your home.
Wow,
so
that's great.
it's that simple. We also put in this add-ons of simplicity in both the jargon and the way it is constructed, and people are reacting, so it is good.
It's great. And the impact of your pilot projects, what is Malta's view on taking care of their older generation? It's important, but what can countries like Malaysia take example of countries like Malta in saying that it's important, but we also need to put in the proper guidelines, we need to do a proper pilot project, like you said, to create some form of convenience for this older generation. So what do you think Malaysia can learn from Malta?
Okay, it is essential to look after your older persons. Those older persons like were you and me, 40, 30 years before. So they have molded the country, they have worked and moved forward the country, and Malta was always at the front. In 1968, it's highlighted the issue in the UN Assembly, where we spoke about the need that older persons and the challenge of older persons going forward must be tackled. In 1983, the first international office for aging opened in Malta, so Malta is synonymous with that. And the point to take Malaysia on and take into consideration what Malta is doing is important. I believe Malaysia's growing up economically.
We have a 94-year-old prime minister, so he's pretty old. So yeah, so we have a very good. He's a very good example of what you can do. Actually, age is not a number.
Age is not a number.
Yeah.
At 80 at night, you're still young. Depending the strength, your mental strength, your physical strength to go forward, to learn, to experience. So those are the main points that Malaysia can take, and even like the Maltese dementia strategy, which was first launched in 2015. There is a whole methodology and framework of what our plan is for the future from 2015 to 2023 and thereafter. So a strategy is essential, and so other countries can, like Malaysia, can take note and plan ahead. Planning and creating a strategy like this takes time, resources, people. It is hard. For Malta, it was hard to find the good set of people who are knowledgeable. But with a strategy, you can plan, visualize, train people, do pilot projects, initiate television campaigns like we did on national television to educate more people. They can, like Malta's doing, is taking drama, street drama, to each locality, so that through drama, don't just go there and watch a heart-moving or a great show, but when the show is finished, through our professionals, and
try to deliver a message.
A message, so people can query, get back feedback immediately, and get booklets that we have printed for nationwide distribution. So that is why a strategy, a national dementia strategy, is essential for each country.
So thank you so much, Sean. Talking
pleasure.
about that, the National Dementia Plan of Malta. We'll be right back talking about that, getting more information and how the plan actually started. Join us back. This is Health Matters with me, Dishen Kumar.